COVID-19 made its entry into the shores of Nigeria in February, Nigerians received it with trepidation, given the tales of woe that trailed it in other countries. Now, Nigeria appears to have seen the worst days of the virus, with 1,155 deaths as at the last check, and nearly 4,000 still battling the dreaded infection in the country. However, rather than strengthen the resolve to see off the pandemic in Nigeria, the flattening curve seems to have propelled a return to old ways. Those who wear masks in public places are now far and few in between. Personal hygiene practices have largely been dropped. Hand sanitizers are no longer available in offices, and hand washing facilities are no longer provided. At the same time, there seems to be a steady rise in the number of cases recently, with 180 cases officially recorded across the country on Thursday, and the Presidential Task Force on COVID-19 warning of a possible second wave of the virus, like in several other countries. So, is a second wave here already? What needs to be done to kill off the virus in Nigeria? These are some of the questions we intend to ask on Nigeria Today. Welcome to the program. I'm Victor Azu. Now, to evaluate the 2020 the virus issue in Nigeria as it stands, let's welcome Dr. Isaac Eboja. He's a public health specialist. Welcome to Nigeria Today.
Good evening. You're welcome.
And also welcoming another public health specialist, Dr. Ade. Welcome to Nigeria Today.
Good evening. Thank you.
Bola Bashorun, I beg your pardon. Now, let me start by asking you, there's been talk of a possible second wave of COVID-19 in Nigeria. Is it upon us now, Dr. Adebobola?
Thank you once again. It's nice to be here. I can see we are experiencing social distance and physical distance here, so that's why we're not using our mask. And truly, before you can say there's a second wave, there should be an upward rise in the number of cases, new cases recorded daily. So those are daily cases you have to chart and to see the trend. So flattening the curve itself doesn't mean it's going to go to zero overnight, but definitely it keeps going down. And for you to say there's a second wave, there must be new spikes. And it can't just be just sudden, it has to be over a period of time. But truly, a lot of countries are experiencing that currently. And even in Africa, we have, I think, Ghana, Liberia, and some other few countries are already experiencing that. So for us, we are not experiencing second wave as at this moment. Rather, we belong to the group that we say we are reporting fewer cases than expected. But it's also good to state clearly here that the number of cases you pick is dependent on the test you do, the number of tests you carry out, and also the strategy you use in getting out the test. So if you are trying to do a more proper approach, whereby there's a hot spot where you can get those that are infected with COVID-19, definitely you may have more cases. And in the case whereby your testing the coverage is low in itself, you have lower cases. So at times your number of cases is highly dependent on the number of tests you conduct daily.
All right, but what do you think has caused the fear? Because there's clearly a fear that there could be a second wave. What do you think it might have been seen or observed to make people feel that, well, we may have a second wave after all?
Yeah, thank you. I don't think the problem is in Nigeria alone. We have 210 countries or territories that have reported COVID-19, and out of these, 120 of them have recorded massive increase in number of cases. And based on that, when you compare what's happening in Europe and other parts of the world, that's 120 countries. Of course, you'd expect that similar thing may happen in Nigeria. So it's more of a fear, and we should prepare for the unknown. But truly, it may not happen in all the countries. And also, I'm aware that people have dropped the idea of people now shake, people now do a lot of things, people now do parties, come together in gathering. They don't obey the non-pharmacological preventive measures that have been preached or that have been guided by PTF, but still, I think we still have to realize that COVID-19 is still with us, and definitely, if we don't manage it properly the way we've been following the advice along the line, it may rebound to another COVID epidemic in Nigeria. So for me, it's the fear first, and observation from other parts of the world that are already experiencing a rebound of COVID-19.
All right, Dr. Bashon, thank you very much indeed. Now, Dr. Gboja, these days, there are no masks, no sanitizers, in most cases, no hand wash facilities, and even PTF briefings have been whittled down. Are we partying too early, in your opinion?
Well, before I answer your question, let me use this time and opportunity to thank Nigerian health workers and all those who have been involved in fighting this pandemic, especially the health workers, wherever they are, whatever level, and whatever contributions they have been making. Very crucial for us to recognize the roles they have played and to appreciate them. Having said that, for me, it is too early for us to relax. Yes, it is true. If you go to some offices now, you don't see hand washing facilities that we used to see. You don't see sanitizers that we used to see. You don't see the enforcement of the use of face masks before you enter those offices, or the check of temperatures before you enter those offices as we used to be. And also, the physical distancing that we were observing seemed to be relaxed a little bit. That is not to say that the problem is over. I would have wished that we don't relax too early. It is far too early for us to relax. Yes, you mentioned the presidential task force that is not giving news briefing as frequently as they used to do. But that is not to say that they have totally forgotten or that they have relaxed. They are still working. They are still monitoring and making sure that when things don't go right, they come up with issues that, methods and approaches that will solve the problem.
But one funny way to look at this is that the prices of PPEs have returned to normal in the market, which may suggest that people are not really buying anymore. Should that be the attitude of Nigerians at this time?
No, that shouldn't be. I think for me, we should take advantage of the fact that the prices of some of these commodities, especially the PPEs, have come down and buy more and stock. The possibility of this pandemic rebounding is still very high. Don't forget that in February this year, we started with one case of a passenger that came from Italy. Within a month, we rose very fast. And within a few months, we were up to 200 and plus. So the fact that we are recording 100 and something, between 100 and 200 cases per day now, is not a reason for us to in any way think that we are safe, we are okay, and that we should relax. I wouldn't. If we started with one and we increased to where we are today, there's no reason to believe that the level where we are, the flattened curve at which we are operating, cannot spike up. It can.
All right, thank you, Dr. Gboja. Dr. Adebobola, if we must avoid a second wave, what needs to be done by the PTF and by Nigerians indeed?
Okay, thank you. The first is, I want to quickly speak to the issue of lower prices of the PP. You know, the law of demand and supply says the more products you have, the less the cost. So initially, during the earlier phase of the pandemic itself, there were massive production of these PPEs. So now people have reduced the buying, the procurement or purchase of this item. So definitely the prices will crash. And I think in form of strategy, people should quickly catch onto this opportunity to buy more PPEs for the country and for the people. Now, going to what we need to do, definitely the PTF has set out guidelines, and I'm aware that the Federal Ministry of Health has this national COVID-19 health sector pandemic response action plan, which has detailed the things that we should roll out within if there's a phase 2, and probably even during the period of community transmission, it has guidelines stated clearly there that we can follow. So I think what we just need to do is to strengthen the communication. Now, I'm also aware that the NCDC has this RCC document, risk communication and community engagement document, which is very, very robust. And I think this is the right time to push things that we have to communicate the risk involved, let people know that this COVID-19 is still with us, and definitely we have to keep pushing to ensure that we reduce the incidence itself. And something we also need to do is to ensure that the no mask, no entry approach is still in order. And
places now.
yeah, we should continue with if you don't have mask, like me, I came here with a mask, of course, but because of the social distance and the physical distance that is here, of course, we can as well do without for some time. But definitely, when we're having crowds, schools in sessions, our markets are opening, we need to quickly go back to the practice of non-pharmacologic prevention approaches. And something else that we also need to consider at this point is, like my co-panelist said earlier, if one case should start again suddenly in another zone or another domain, it's going to spread fast. So we should try as much as possible to also improve our testing strategy to pick any new case we find and to track them. Contact tracing would be very good at this point. Trying to trace those that have come in contact with those that have been infected or reported, and as much as possible, caging them out in such a way that we won't have the spread over again. But truly, we need to keep strengthening the message. We need to pass the message, ensure that the risk communication strategy is rolled out. The document, of course, has been signed. Then also the health sector response to pandemic, to the COVID-19 pandemic action plan should also be rolled out to ensure that we approach it earlier, even before the phase 2.
Okay, thank you very much indeed, Dr. Adebobola. A break beckons now, so we just get the input of Nigerians on the streets. And Nigeria Today returns afterwards. Please stay with us.
Truth is, we can't handle lockdown in Nigeria because of the informal sectors, the conditions we live in, the hardships around. So the measures are very hard, but we can control people who come into the country because there is speculations about the second hit and it's a bit more deadly. So to avoid that, we restrict some of these areas with high risks.
For me, at this time, total reward of lockdown is not the solution. The solution is awareness, because many people are ignorant of COVID-19, because some people in our local English, they will say they go or you don't go.
This is not an issue of government alone. A lot of other individuals come out and assist in helping the less privileged ones, so that at least even if the government is saying, okay, today we are going to place a curfew for every individual to go back and sit at home, he has a food on his table to eat. But if you cannot make that provision in Nigeria, even if you tell people to go back and sit down, they will not go back and sit down.
We need to lay more emphasis on Nigerians, because it seems as if a lot of people, everybody is going about his normal business activities as if their COVID-19 is no more existing. UK just introduced, revert back to the total lockdown of COVID-19. But if we as a Nigerian, for government to say we should revert back to that the total lockdown, is going to have adverse effect on our economy. But the only thing we can do is we continue to enlighten people so that they can adhere to the COVID-19 protocols.
Welcome back. The program is Nigeria Today on NTA News 24, and we are discussing the fear of a second wave of COVID-19 in Nigeria. Of course, interesting perspectives there. But Dr. Boja, should there be indeed a second wave of COVID-19? How prepared would you say we are? Someone was talking about another lockdown and all of that.
Well, there are two sides to that question. The first part is the fact that we already know that there's COVID-19. We've already been preparing, we've already been preventing, we've already been doing and observing many guidelines. So in the event that there's a second wave, we are better off now than we were when we started at the beginning in February, March this year, when we had no idea, we had no clue as to what to do. It was all strange to everybody, to almost every country. But that notwithstanding, we are still in trouble because right now we are recording between 100 and 200 cases per day, and the fact that if this thing comes and it comes in a spike, it could take us unawares. Because many people now don't even remember where they keep their masks, when they don't keep physical distancing. Places that we have advised that they should not open, like the restaurants, the churches, the mosques, the home parties and so on, they are going on. Burials, if you go to some villages now, you see burials taking place as if nothing has happened in this country or is happening in this country. We need to be aware of the fact that this kind of issue is not something that you take lightly, because the virus is not going to tell you, knock at your door and say, I'm coming. It is already here. It's a matter of multiplying.
Okay.
And the curiosity that we should have, and the worry, is the fact that all viruses do sometimes come with one strain or another. If a different strain comes up now and is more deadly than the one that we'll be battling with, then we are in trouble.
Okay, Dr. Adebobola, what telltale signs, should we look out for to say indeed there is a second wave of COVID-19 in Nigeria? In recent days, there has been a steady increase. We had left this realm of 180, 200 for quite some time.
Okay, thank you. The usual thing is the first, of course, is data. Data has to tell us, we have to the data, the increase in numbers, comparing the numbers of one period to the other. Now, like I said earlier, 210 countries have been affected with COVID-19. 120 of them are having massive increase in number of cases, and about 81 have slight increase in number of cases. And what they did was it was compared the 2 weeks prior to November 6th compared to what is currently having 2 weeks after. So you have to compare over a period of time. It's a trend analysis thing. And if there is constant increase based on the number of tests, so in this case, your denominator, that is your testing number, should almost be the same. Probably last week you tested let me say 5,000. This week again you are testing 5,000. Next week you are testing 7,000. And based on this denominator testing, your number of cases are increasing. It simply means there is something that is increasing. So you can't just base it on just solitary or single indicator to say we have 100 today, we have 70 tomorrow, we have 300 next tomorrow. It depends on what quantity did you test before you achieved these figures. Now, looking at it from that perspective, it simply means the symptoms are still the same, they won't change. And in Nigeria, for example, those that have been infected, they are less than 10%. So I don't expect a herd immunity. Herd immunity is a system whereby even is a body system of social distances per se, where instead of transmitting from one person to the other, probably a third person or second person is already immune. So that transmission from the second person to the third person won't exist. So it's an automatic way of saying you are breaking the transmission. But since we have less than 10% of Nigerians infected already, I don't think we have adequate herd immunity to protect us from getting reinfected. Now, for those that have been infected in the first place, they have just about 5 to 7 months for the antibody against COVID virus itself. So it simply means they can be infected maybe after 5 to 7 months based on their level of immunity. So for us, what we need to focus on is a system where once you have these symptoms close to what we already know, coronavirus, of course, the sneezing, the fever, the myalgia. Myalgia is body pain, malaise. Of course, test for COVID-19 to know whether you really have it or not. And once you have that, you now form part of the figures, the data that will give us the informed decision to say, consistently we are increasing the number of people tested and also increasing the number of cases picked. And once we can see this trend for a while, maybe 3 days, 4 days, 5 days continually, then we are sure that probably there's a second phase. But I don't expect Nigeria, because internationally it's been argued that the winter period may also usher in a new second phase. And close to Nigeria, if you look at it, when the COVID started in Nigeria, it was close to the beginning of the rainy season. Now the rainy season is over, already transiting to the harmattan season, transiting to the dry season. So this will be a very good period for us to observe, to monitor the cases, the number of cases, and if there's going to be an increase in number. But the telltale sign is data. We need data, evidence-based data.
Thank you very much. Now, one more issue that bothers, because what fuels the people's attitude to the virus is this issue of facts, versus myths. How can this be handled, Dr. Egboja, to ensure that the gains of COVID-19 fight are not lost on us?
Well, it's to balance the struggle for survival against the need to prevent the disease. Yes, people need to survive. Yes, people need livelihood, but they also need life itself first. They need health before they will go for livelihood. And when people think that, well, even if I get COVID-19, it is not going to kill me, or the number of people that have died are not that much, therefore I don't need to be frightened, I can go out and do whatever I need to do in terms of earning a living, that is a wrong perspective. We must try to balance the two. Yes, we need to survive. We need to do things that will make us survive, but we also need to do things that will make us survive in a regulatory manner at this point in time, because of the situation in which we find ourselves.
Thank you, Dr. Egboja. Let me run for the last time to Dr. Adebobola. What lessons have been learned so far that may be applied to see off a second wave?
They said novel coronavirus, new coronavirus, new strain of coronavirus called SARS-2. The greatest lessons learned is we now know much about the epidemiology of the virus itself, or of the disease itself, the morphology of the virus, and truly, there are over 150 vaccine trials ongoing. So we've learned a lot, and I don't think things will be as bad as it was in the early in the year. And definitely another lessons we've learned is how to engage the community. Like I said earlier, we never had a lot of documents guiding us on COVID-19 response. Now we have a series of documents that can guide. So the right thing is, let's know the point to initiate their use. And once we initiate their use, we are going to be able to stop the transmission. And truly, the vaccines, by the time they are released, they are going to help us a lot to reduce this transmission. We are going to have, in quotes, secondary immunity. And we'll be protected for a longer period.
All right, thank you, Dr. Egboja. Your closing remarks. Let's make it about, what the attitude of Nigerians should be going forward if we must avoid a devastating second wave. I have just 20 seconds for this.
Okay, fellow Nigerians, COVID-19 is still with us. Let us still continue to observe all the guidelines, all the rules, and do not yet relax, because if we relax, the possibility of relapsing of the disease reoccurring again, even in a worse situation than we had before, still exists.
All right, Dr. Isaac Egboja, specialist, public health specialist, thank you very much indeed for coming on Nigeria Today.
My pleasure. Good evening.
And an equal measure of thanks to Dr. Bashorun Adebobola, medical and field epidemiologist.
Thank
They're
you.
also public health specialists. Thank you for your insights on the program.
Thank you very much. Thank you.
Now, Nigeria Today returns on Monday at 7:30, but you can spend your weekend watching this and other editions of the program on www.youtube.com/NTA News 24 Hub. My name is Victor Azo. Thank you for your company.